So now we talked about all the skeleton except for the lower limb, so we're going to talk about the lower limb. The lower limb, we can say that it consists of two parts. We have the pelvis and we have the limb itself. The pelvis, or the pelvic girdle, is like the pectoral girdle. It consists of two bones, but the difference is that these two bones are actually joined together from the back and the front, anteriorly and posteriorly. On the other hand, for the pectoral girdle, each one of the scapulae is found on each side of the body, and there's no point of connection at all. So the pelvis looks something like this. So this is one side. So we're looking anteriorly at the left pelvis. Here, posteriorly, we can see the sacral vertebrae. As we mentioned, they are wide and large, and they are fused together like this. And then we will see the coccyx. And here, the other pelvis is found, and it's joined with this one through this cartilage, and this point is called the pubic symphysis. The pubic symphysis. So anteriorly, the two pelvic bones are joined together through the pubic symphysis, and posteriorly they are both attached on the sacral vertebrae. Now, what does the pelvis consist of? We have three parts. This broad part here, this wide part, is called the ilium, and the anterior part is called the pubis, and there is a posterior part which is found around here, posteriorly, is called the ischium. It's called the ischium. Now, if we have a lateral view, we will see that here we have the ilium, and this would be the sacral vertebrae and then the coccyx. And so it will look something like this. This is a lateral view. Now, this is the ilium, and the ischium is this part. So this is the ischium, and this is the pubis. Now, this opening here, this one, this part, this is called the obturator foramen. Obturator foramen. Foramen means hole. So this is the opening or the hole through which the obturator nerve passes. So this is why it's called the obturator foramen. The obturator nerve is a very important nerve for the lower limb. A lot of people, when they first learn about the pelvis, they think that this is the opening on which in which the head of the femur is inserted and articulates. This is a common misconception. The head of the femur articulates through a depression which is found behind this point here. This is posterior, which is this depression here. This depression is called the acetabulum, and this is where the head of the femur articulates, or this is where the hip joint is formed. Now, we will look at the bones of the lower limb. So we will draw the pelvis like this. and the head of the femur will articulate around here, like that. So as we can see, this is the shaft of the femur, and here we have two condyles, like this. This is the femur, and this is the head of the femur. And then we will have a bone that articulates directly with the femur, and this bone is found medially on the inside of the body. This is called the tibia. So this is the thigh, and this is the leg. So the tibia is found medially or anteriorly, and we have the femur. The femur articulates with the tibia. It doesn't have an articulation point with the femur itself directly. So this is the fibula. The fibula is found laterally or exteriorly. So these are the bones of the leg. Now, as we mentioned, in the upper limb we have the rest, and the rest is formed out of 8 bones. It's formed of 8 bones. For the ankle in the leg, here, the ankle bones are found around this area. They are 7 bones, which are called tarsals. On the other hand, the rest bones were called carpals. So here we have 7 tarsals, and the rest we have 8 carpals. So 7 tarsals, and after that, after the tarsals, we have the bones that form the sole of the foot, like this. These are called the metatarsals, like metacarpals, and there are 5 bones. And after the metatarsals, we have the phalanges. For the big toe, we have 2 phalanges, and for the rest of the toes, we have 3. Like this. So tarsals, metatarsals, and then we have the phalanges. So this is a quick review of the lower limb. I hope it was easy. So now we're done with the skeleton. Next time we're going to talk about the concept of movement in living organisms, and we'll start with plants as usual, and then we're going to talk about movement in humans. So until then, I thank you for watching, and see you.